We have to move on to Mr. Davies now.
Thank you, Mr. Chair. Thank you, Minister. Thank you to the staff for being here at this early hour. Minister, of course, you know, after 2 years of study and hearing from almost 100 witnesses and over 30 written submissions, this committee released our final report called Pharmacare Now, Prescription Medicine Coverage for All Canadians on April 18th. And after consideration of many different policy proposals, this committee concluded that the best way to move forward is by expanding the Canada Health Act to include prescription drugs dispensed outside hospitals as an insured service under the Act. In other words, to make pharmaceuticals part of our single-payer public system. That was the considered recommendation after 2 years of study of this committee. As Health Minister, I'm interested, do you agree with that recommendation?
Thank you so much, Mr. Davies, for your question. And as I've indicated, we recognize that Canadians pay way too much for drugs, and that's why that we are moving forward with the implementation of the Advisory Council and the implementation of Pharmacare. We recognize that Dr. Herrick Hoskins is very well positioned in order to chair this committee, and we've instructed him that we want to make sure that he presents us with options regarding a national Pharmacare program, what that could look like. We have no preconceived ideas as to what that is going to be. I have no preconceived idea as well, but we certainly want him to come forward and the Council to come forward with options, but also the implementation on the way forward, because we recognize that having 13 provinces and territories being a member of a federation, we certainly want to make sure that we get this right. And with respect to our council members and also our chair, having been the former health minister of one of our major provinces, he certainly recognizes the challenges that we could meet going forward. So we certainly want to position the council to provide us with that information that we need with respect to the implementation plan. And we don't want to wait. We want to make sure that the committee gets out there. And I have to say that Dr. Hoskins already, our board members, as I've indicated, I'm hoping to be able to make the announcements in the very, very near future. But Dr. Hoskins himself has already been in the process of meeting with provincial and territorial health ministers.
I mean, my question was what you think. My question was what your opinion is. Do you agree? There's different ideas, and I'll turn to another idea. Your colleague, the Finance Minister, Mr. Morneau, less than 24 hours after announcing the Federal Advisory Council on Pharmacare, rushed to clarify that he isn't looking at implementing a universal pharmacare plan, but rather a, quote, fill the gap strategy. By the way, exactly the strategy this committee recommended not to pursue. Here's what he said, quote, so you said a national pharmacare strategy, not a national pharmacare plan. Those are two very different things. We recognize that we need a strategy to deal with the fact that not everyone has access. And we need to do it in a way that's responsible, that deals with the gaps, but doesn't throw out the system that we currently have. So my question, Minister, is, you have one of your colleagues who very clearly is rejecting a single-payer universal system in favor of one that is a gap-filling. And I'm curious, as Health Minister, shouldn't you have a position on this? Shouldn't you be telling Canadians what your view is, what you're fighting for at the Cabinet table?
I am going to be very clear that I'm encouraging our Advisory Council to continue to have a national dialogue with Canadians and experts in this field. I've made it very clear that I have no preconceived idea as to what the outcomes of these options are going to be presented, but I'm going to be very clear. We have made it very clear from the onset that there is no preferred option that we are looking at right now. We want the Advisory Council to provide us with the work, and we also want the Advisory Council to build on the good work that this committee has done. And I say that, very honestly. I recognize that this committee has done tremendous work over the past year.
Appreciate that.
We certainly want the Advisory Council to build on that work as we move forward.
Thank you. I want to move to opioids because you made a reference to it. Minister, we just had in British Columbia overdose deaths spiked again in March, reaching the province's second highest monthly total to date, according to the BC Coroner Service. That is the second highest month ever recorded on record, second only to December of 2016. And we know that last year over 4,000 Canadians lost their lives. Some estimate that we're on track to exceed that, maybe as many as 6,000 Canadians dying from overdoses this year. Now, at the Liberal Party's convention in Halifax this year, your party's grassroots voted overwhelmingly in favor of decriminalization and medical regulation as a means of responding to drug overdose deaths. In response, a coalition of 200 organizations, researchers, policy experts, including former Liberal leader Bob Rae, and others impacted by the opioid crisis wrote your government an open letter urging you to, and I'm going to quote, "Be the progressive government you promised to be, choosing human rights and evidence-based policy over ideological relics. We need you to listen to our voices as we call for the essential next step, decriminalization." The example of Portugal and other European countries illustrate that this policy works. We ask you to prevent thousands of more unnecessary deaths by supporting this resolution. However, you and the Prime Minister have both responded unequivocally ruling out acting on that resolution. So, Minister, given the severity of the opioid crisis, given that we expect as many or more deaths this year as any other, why won't your government even consider the evidence-based proposal of decriminalization and medical regulation of drugs?
I've made it very clear at the many events and committee appearances that I've made that the opioid crisis is a file that we certainly have been doing a lot of work, and a file that keeps me up at night. I've indicated in my opening statements that my first tour that I did, my first visit that I did, was in the downtown east side in Vancouver, and had an opportunity to meet with many frontline service providers and many people with lived experience that shared with me differing points of views. With respect to decriminalization, with respect to your question specifically, we recognize that decriminalization alone would not ensure quality control of drugs on the street. It certainly is not going to prevent all of the deaths that are happening. We also recognize that when we look at the Portugal model is very different than the Canadian model. We recognize that in Canada, provinces and territories are the ones that provide direct services to clients. And with respect to the federal government, we are not the ones that provide the direct service delivery. As a result, our government has taken a comprehensive, compassionate, and a collaborative approach working with provinces and territories, and we are using all the tools at our disposal to ensure that we can provide compassionate care to services. We've also made, and as you're well aware, we've made several regulatory changes to ensure that we could ensure that medication replacement therapies are available for individuals. This year alone, we've made methadone available without doctors having to apply for class exemptions, and also diacetyl morphine. So we are certainly moving forward in ensuring that we can use all the levers that we have at our disposal to effectively deal with this. The other thing as well that
I have to end that now.